Hi, Dr. Minkoff here. I want to talk for a little bit today about teeth. So this is an average tooth, all right? Molar tooth. It's got a crown, it's got a root, the gum line is here, and the way a tooth is actually bone, so it's living tissue. And there is a nerve, an artery, and a vein that come up through the bottom of the tooth into this space which is called the pulp. And since the cells out here are alive, there has to be a system so that the nutrients can get to those cells and the waste from those cells can get out. And these little dentin tubules in an average molar tooth, there are 2 to 3 miles of them. They're like millions. They're very short, but if you put them end to end, it'd be a couple of miles. Now, what happens? So you get a cavity. The enamel breaks through here, and you don't get on it right away. Or you get a cavity and the dentist puts in an amalgam filling. Amalgam is like half mercury, then a mixture of silver, tin, copper. Now, the amalgam, when you eat something hot, is going to swell. And when you eat something cold, it's going to shrink. And it doesn't really bond to this side of the tooth, so the bacteria can come and get in here. So if it's an open filling, they come in. If it's an amalgam filling, they come in. If you get a white filling, they actually bond with the tooth and they're pretty secure. They don't let things in. But if bacteria come into here, they can go into these tubules and start to live. They can track all the way down to the bottom here and form an abscess. And somewhere along the line, you're going to feel pain. Sometimes it tracks out here and it'll come up here and there'll be like a bleb on the gum, which is a pus pocket. Now, what does a dentist do? Well, you have pain, so he's going to try to help you with your pain. Usually what happens is that you get recommended that you have a procedure called a root canal done. And you go to a specialist usually, and that specialist is going to drill down through here, clean this out, put some cement in here, and a post, like a metal post, because when you drill out the tooth could get fragile. So you put a metal post in there with some gluey stuff, so that now you have like a rebar in the tooth. In the process, the nerve and the artery and the vein are obliterated. And the bacteria that have been living in here are still there. And the stuff that's supposed to seal it off doesn't seal it off. And so now what you have is a dead tooth that's infected. Now you're happy with the dentist because it doesn't hurt anymore and it looks good. And the criteria in dentistry is if it doesn't hurt and it looks good, we did a good job. But really, you have a dead infected organ in your body. Now nobody in medicine leaves dead infected organs except dentists. If you've got a dead infected gangrenous toe, you cut it off. If you've got a dead infected appendix, you cut it out. You can't live with these things because the poisons will kill you. And the problem with this is that these poisons kill you, but they do it slowly. Okay? Now, I'm not saying that everyone is bad, but I can tell you 100% that every chronically ill person that I see with Alzheimer's, Parkinson's, MS, chronic fatigue, chronic Lyme, if they have a root canal tooth, it's a big part of their problem. and cancer too. And if we don't get this out of their body, they basically will never heal. In my experience, they never heal. Because these guys that are in here are anaerobic bacteria, and they're very toxic. And if you put a whole bunch of this in the water supply, you could kill a lot of people. We used to be able to do a test on this where we could take a stiff piece of cardboard and stick it down here and get some of the juice from the abscess and pull it back out, and we could send it to a lab, and the lab would do an assay on the toxins. And what we would find, and we would do a healthy tooth on the other side, so we had a comparison, is that there was like 95% block of the enzymes in the body that produce energy, Krebs cycle enzymes. There would be 95% blocked, so they didn't even work. So this stuff leaks into the tissue, and it's a problem. Now, some very interesting research has been done. They took a large group of men that had had fatal heart attacks. Okay? So a heart attack is when the arteries that go to the heart muscle block up, usually with a clot, and then the heart muscle doesn't get blood, and then the heart has a spasm and it doesn't pump and you die, or you have an arrhythmia and you die. So they took a sample of the clot that blocked up their artery, and they did a test on it where they could look at, were there bacteria in there? It's called a PCR test. They could look at the DNA of the bacteria, or question was, were there bacteria in the clot? And then these men also had root canal teeth. They pulled the root canal teeth, they took a sample of the abscess, and they did the PCR on that too. And they found that 75% of the time the bacteria from the tooth were in the clot, which had killed the guy. Now, it's been known for a long time in cardiology that if you have deep pockets, gum disease, that those bacteria lead to heart attacks too. So this is a known thing. But if you're walking around with these things, you could end up with a problem later on because nobody's looking at this. When I get a new patient, when I see that on the record that they have had a root canal, my first action is I send them down the street and we do what's called a CB CT. So this is a CT scan. CB stands for cone beam. It's a cone beam CT of the teeth only. And I write on the report, rule out abscess. And in about 95% of the people who have root canal teeth, the dentist report, the radiology report comes back, positive abscess. Yes, there's abscess there. There's an abscess sitting right here, which is brewing. It's an infection. It's a chronic infection. And it's affecting the body. Now, the other very interesting part of this is that the teeth are on nerve pathways which go to other organs. And you probably heard the term stomach teeth. You know, like the stomach teeth are coming in. Now, the stomach teeth are the molar teeth on the top and the premolar teeth on the bottom. The stomach teeth equates to what's called the stomach meridian in acupuncture. And the stomach meridian goes through the thyroid, the breasts, and the ovaries. And we have many, many cases of breast cancer where they have root canal teeth on the stomach meridian. There is an impairment of nerve flow function that goes through the teeth on the way to the breast from the abscess. So this is really important. And I've had people with chronic low back pain where it came from the teeth. So if you have, number one, you want to see a natural dentist who understands that the materials that they use for filling should be compatible with you. And that the procedures that are done on teeth are procedures that are going to actually enhance your overall health. It's better not to have an infected dead tooth than to have one. And so dentistry is very important. You know, brush your teeth twice a day or 3 times a day after every meal. Floss every day. and get regular dental checkups by a dentist who's a natural type dentist, who's thinking about that the mouth is part of the body and the teeth are part of the body, and not to do things in the mouth that you wouldn't do in another part of the body. And that, for your overall health, is really important. In everything from chronic pain somewhere else, to a heart attack that you definitely don't want, to breast cancer that you definitely don't want. Okay? A lot of people who have chronic thyroiditis have lower molar teeth, premolar teeth, where there's inflammation or infection, and it can affect the thyroid. Okay? So take home is take care of your teeth, and then see a practitioner who's a natural dentist who understands this stuff, and they can help you the best. Okay? Hope this helps.